Thank you for this introduction. Is he on? Yeah. But you forgot one line in that story. It should be said, and he was invited by AI Grun, because that is really an honor to be here at AI Grun. Not only because AI, but also about Grun. As I will tell you during this talk, we also work together with some partners and institutes in Grun, and I hope as working for TNO, that I can translate my passion and the project and experiences and during this 20 minutes also to you. So I'll try to look into your eyes, and when you're frowning or something, I need to tune back a little. However, let's see where the story is about, because you have read a quite complex title. I will tell you about theory of mind, which comes from psychology and is now into the field of AI. And I will also tell you a little bit about that container the topic on trust. And because it was also said, we are a lot of developers down here, please go also into some details and, well, take us from high level until some slides that maybe you can use in your projects as well. One thing about the TNO organization where I'm working for is that there are various units and areas and discipline. And for us of today, we are in this right down corner on ICT and policy and strategy. But just know that TNO is at a lot of different industries in the Netherlands. And our role is actually twofold. Wanting to know how things work and then build things trustfully or a responsible AI or build it and just know how it works, but then to apply it in a responsible way in the society. That is the broader role of the organization. It has been echoed already also this morning on the AI Factory. That is a role where TNO takes an orchestration role. What I do like personally myself is the first-time engineer role, where we build things, smaller projects, but also large programs, the GPT-NL, for example, and being a front runner and combining it with academic knowledge, work with universities, be the first one in new technology. Personally, I do like that role, and I also am happy to do that in the projects in which I've been involved. The office TNO in Zernike, Groningen, 100 people working there. We are doing this project that I'm going to talk about of the digital doctors together with the university, the Benoeyen Institute, mainly on the topic of computational cognitive AI, where the theory of mind will get a place. And with the application of all this knowledge and experience, we're working very close with nuclear medicine and pathology at the University Medical Center in Groningen. So the UMCG, the hospital, where it is actually not only about technique, but also how this technique is part of the workflow of humans, in this case the doctors, in the way that they ought to work, that is to help, to care, to fight cancer, and to help this tremendous increasing number of patients, to help them. And let's see if we can apply AI a bit for in the healthcare, in the jobs of the doctors. Formerly, let's say 1 or 2 years ago, we are in the field of AI where it is about data, lots of data. We talked about learning, the whole transition from machine learning as a topic, and now everybody calls it an AI algorithms. So learning was important. And for those who are working for customers, it was also in many industries, AI helps processes to optimize processes for various application purposes, whether it's manufacturing, and whether it is logistics, or indeed, like today on healthcare, dealing with information. Nowadays, things have changed. AI is no longer anymore a technique. It is about the impact of AI in our society. It is about how we perceive this impact. So perception is a keyword related to AI. And as I will tune down on theory of mind, perception is something that is also inherently human, that's becoming more and more important in the field of AI. And there you can also say something about trust. When do you trust an AI algorithm or a system? When is it trustworthy? And what does it do with our society? Do we trust AI as an overall container topic, do we trust it? Well, you can only dive into that field if you go a little bit into some subtopics. And therefore, also in the project that I'm going to tell to you this 20 minutes, it has to do with the transition of a tool to a companion. When does that AI tool in a medical context become, well, an assistant or a colleague or something that is part of your work? How about behavior? Behavior of the team, where that AI algorithm embodied in an agent, so we go to agentic AI, plays a role. Is it really different from being a colleague? And why and how? Or sometimes it looks like your colleague when talking to him or her at the coffee, for example. And do we want to go into that area? Why? Why do we want to have social behavior in that? Why do we talk about cognition and the way how algorithms learn and expectations about that learning process? And what if we soon, and I think within 2 to 5 years, we seriously are confronted with mechanisms programmed into our AI algorithms that needs to that deal with responsibility? Is it always the human in the end responsibility for the act of the organization where that AI plays a great role? Or can we slowly incorporate that? And accountability, okay, it will take a while that we put an AI into jail or at court, but still accountability is something to get built in the algorithm sooner or later. We humans also do that when we reason in a clinical decision support setting. We reason, but the reason is always like, okay, is it okay for the society? Am I allowed to give this answer? What is my role in this decision-making process? That has to do with inherent feelings of responsibility. What if you are not responsible at all? You can give all these information and ideas to whatever and whomebody. We as humans don't. AI algorithms soon will, and how do you say it, to incorporate the notion of responsibility in their task, so in their way they act. If so, and if they are working together with humans, we are, well, if humans work together, they always take into account the other in which you are cooperating or maybe competing, but you all have a notion of the other. That is a theory of mind. I'll come back to that in a second. That happens not when we use these current systems, but near future systems, perhaps today already, we have these systems that become more and more proactive. Then we talk about agents. Or if you now go to these, well, all types of large language models embodied into a kind of a chat or bot, that's fine, but it's still prompt driven. You give a question, the thing gives an answer. Then you have a dialogue, but still it is prompt driven. Sooner or later, the AI will come and say, hey, how about this? Yesterday we talked about that, and why wouldn't you do it today similarly? For example, if you have a coaching application where in mental health situations, the idea that the AI triggers you is becoming more and more normal. Yeah, perhaps normal. Because if you look at the cases of pathology, and now I come close to a case example and I will explain it more and more. So pathology is about identifying, let's put it black and white here now for the story, good cells from bad cells. You do an analysis under the microscope and you have to say something about the presence of cancerous cells, for example. Pathology is a domain where humans and algorithms will work closer and closer together. But that's not just another algorithm. It is actually a layer on existing algorithms. Because since the 70s, detection of things and computer vision was already there. And we also had a layer of algorithms saying like, oh, I detect some pixels, but these belong to the liver, or this belongs to your heart, kidney. These are your lungs, and this is a type of cell A, and this is type of cell B. It's all there. In healthcare, we have also AI algorithms that make decisions or help to make decisions for treatments. Personalized treatment plans, I don't need to tell about that because that is already, at least, it is technology that is already there. What is missing is the adoption of all these technologies in the workflow. Yes, it is abundantly available, but no, it's not still a natural thing in our workflow. There are tools that we consider. There are advanced tools that help us when we look with a camera through our body and say, please help identify areas where I as a human need to watch a little bit closer. That's all tooling. But sometimes you have the situation where the tool says A and you as a human expert says B. I'm not totally convinced with what the outcome of the tool is. And thinking about that, you say, okay, perhaps I miss an extra layer. Put it on top of it. Well, if you use it at home tonight when you're cooking, or maybe tomorrow, whatever, if you have too much beer, you could go asleep after today. But you can add an extra layer on your cake. That's a topping. But you can also bake an extra element, bake it along with the cake that you are making. So make it a part of the algorithm. Adding it to an existing algorithm or making it part of. Then usually it's like, okay, adding a part, so you are doing something with theory of mind and add that onto algorithms. I'll come to an example in a minute. But before doing that, I would like well, for those who are not aware about theory of mind, I made for today, for the AI Grun, I don't use this classical example, but I use the version of AI Grun. To get the notion of theory of mind and to apply it in your AI algorithms later on, you have to be aware about this. Suppose we have Sally and Anne, and Sally puts a ball in the basket. And then when Sally goes away, I know this is an example that you will like, Anne comes and places the ball in the box. How trivial it is, the question to answer, where would Sally look for the ball? And we all know that this trivial example is very easy, but that is because we are over the age of 3 years old here in this audience. Before 3 years old, this is the psychology, social psychology experiments, the young children are having difficulties in answering these type of questions. Humans have that naturally built in. We indeed recognize or are able to recognize the beliefs of others, take their perspective, and then say something like, if I were you. That's important, if I were you. And also, perhaps you have an idea that you have a common ground, that you know what the other knows. Basic example is when you drive home and you stop for a red light, you know that the other one has if a green light can go, but it's also when you have the green light that you know that the others know for red light I have to stop. That's even more important than just your own knowledge. So having a notion what the other knows, thinking from their perspective, that's important. So in this setting, together with UMCG, we have a situation and use cases where we have the analysis and the dialogue about interpretation of a scan, total body scan. Unfortunately, and maybe also you have it for your close relatives or even for yourself, these nasty situations. But we have at the UMCG a big facility with a laboratory for total body scans, most expensive one, by the way. And then after the scan, there is a discussion between the doctors, one the oncologist and the other the lab specialist, because he was preparing and making the scan. And the interpretation of the scan can be a dialogue where one, the doctor says, I see an increasing level of uptake, of accumulation here. And the other might think, like, I'm not sure. What it's normally doing, humans, I state the human in this example first, is that there is something in the brain of the other. I know that she knows it, but what is it that she gives this argument? What is her justification about this? And while this thinking takes place, there is also an answer, and then you have a dialogue and you decide on, okay, maybe I agree given your reason, your rationale behind. So indeed, if there is something like, well, look here at the right, that is what humans do in a negotiation. A second thing is, perhaps if I'm thinking differently, I know something what the other doesn't know. Asking that in parallel to do your task of classification is something that we humans do without thinking. Now one step deeper, the AI. What because the increase of scans that need to be taken, given 2 years from now, we will have a huge increase of the need for taking these pictures, these scans. It will be that we have cancers 10 times more than now. So more scans, but not more people doing that. Perhaps we have AI support there. At the moment, beginning that with reporting, AI is playing a role already, and slowly it will take up more and more. And with technology, it will be having a role to do more and more in the collaboration with human doctors. Back to the story. If we build the AI not detecting the amount of uptake or given a reason about what the next step should be or whatever, but also take the AI in the setting like, hey, what is it that in this dialogue it makes my answer different from that what the human thinks? That is important. Also vice versa. If you as a human, I talked about trust and trustworthy system, if you work with an AI algorithm and that AI algorithm gives an answer, yes, we do have explainable AI, but there's one layer on top of this, that is, when do you give what argument to the other? What do you expect from the AI when you have a dialogue and the answers are still different? Who's right, the human or the AI? Okay, well, then it is to think about the next step. How to incorporate theory of mind in this. So how can you write or update or enhance a AI algorithm that takes into account the things of the other? Well, as explained, the situation at pathology allows us to do experiments on this. If I take you along how the process goes, then you will understand what the role will be for the AI algorithm. It is normally the case, and luckily I was been there, that they have a very practical setting. When they have some cut out of tissue, you will be presented there at the hospital during one day, and while cutting away tissue, if it is, for example, skin cancer, it has been cut into slices, after freezing, cut into slices, colored, and these colored images are then being put under the microscope by one, but most of the time 2 pathologists. Our AI is now looking along with the pathologist and say, for example, if you look at this tissue, the areas I have learned as an algorithm to detect areas and support you in the vision, in the things that you see. So I highlight the interesting areas. Normally, as a tool, the doctor would say, oh, yeah, thanks. I see that too. Thank you very much, AI tool. And what happens if the AI, and then look at the white arrow, asks like, hey, what do you think about this area? I have not trained yet to detect it, but perhaps given all this experience that we built up together, there might be something of interest right there. This is different from a tool. This is notifying the human, have you also considered this? Note about this phrasing, have you considered this? This means that the AI has somehow a notion about what the doctor might know or might not know. Suppose it was like, if I were you, then I should have a second look at this area. And there it was, actually, we had these mechanisms and thought over where the pathologist at the UMCG said, hold on, before you continue with this analysis, if you were me, so your AI algorithm, nicely put it on top, is eating inside my brain to follow what I'm doing. Yeah, and then I was thinking, this is the end of the project, he doesn't like that. But after a while, in a minute of silence, he said, but actually this is something that we could develop together. So it gains his trust. And then he said, yeah, actually, what we encounter is these systems come with all types of advices, but some of the details we already know. So if the AI here in this setting has said like, hey, have you considered this? Then the answer of the doctor could say, hey, interesting, agree, because I see the color is important. And as the AI system knows that sometimes the shape, sometimes the color of all these arguments are given back and forth in the dialogue, he now thinks, okay, every time I pinpoint to that unknown area, it's the doctor saying or confirming about the color, so he might prefer the color a bit more than the shape. As a matter of fact, the AI algorithm here learns, and for those who are interested, multi-agent reinforcement learning or reinforcement learning in general are the underlying techniques. It learns to get a notion that the doctor finds color more important than shape. That can be handy because next time if there is a similar area, then the argument or the justification could be like, hey, dear doctor, look at this area. It's about the color. I think that this needs attention as well. Just by the fact that the AI at that moment says perhaps about the color that has learned is different than just the notification, hey, how about this area? It would be like a human. Hey, I looked at the color of these things and I see that this area, hey, by the way, the color, you're right. That means that if you were collaborating, the human gets a notion of the AI here about, oh, right, color. Yeah, I would have said that indeed. It's not proven, but it is the human perception that then thinks like, that AI system, whatever it does, it gives an increased level of trust due to that dialogue. So here we are sitting together with Andra Minculescu, one of the students, and we are sitting there, but hey, hold on a minute. There is a game on that screen, not a piece of tissue. That's important, because what was the project? The project was about developing and testing, I can say what is the project, the notion of theory of mind. That means that we need to do thousands of experiments to test this type of algorithm compared to just an algorithm that is used for that detection of things. Okay, and how did we test this theory of mind using reinforcement learning? That is to gamify it. Why? Because we have players that play the game to efficiently detect cells and collaborate on the detection of malicious cells. So we changed the tissue to a game board, and we had a dialogue about, hey, there are cells which are unknown or need to be clarified. These are marked with an X. And what we want to have is a consensus between the two players on whether or not they are cancerous or not. That requires one more thing, that is somehow for thousands of experiments automate a doctor. And a doctor, well, we can discuss whether or not you should do this, but for the theory of mind first step, we must have some kind of thousands or 10,000s of experiments. So therefore we had a list of preferences, we had a dialogue with interviews with doctors, like how do you classify, what do you prefer, and so forth. The doctor then has a list of answers. We can do these experiments with multiple types of algorithms. The first one is a baseline, does not include theory of minds, just a detection. And the other is about believing the other, like, hey, the other thinks like this, or believing the other, taking the perspective and the beliefs of the other. And the third one is also focusing, okay, given the answers, let's put that into common ground. Why? If there is an advice from your AI system and it starts with, hey, we recently had the same situation, you remember? Therefore, I think that really helps. Also, when humans collaborate, you know what the other knows, and based on that, you can say, this is what my outcome is. So if the knowledge in the agents, the system then represents something like look at neighbor cells, and then do that classification. There can be thousands of other rules, but we had this simple setup for look at the type of the neighboring cells. Put that into a rule table. These are just the rules of a detection. You can do thousands of ways of doing detection, but what we want to do is a simple way, detect and then add the theory of mind. So, for example, if you have a piece of tissue at the left upper side, you just look around and you count the number of cells and types, put that in the table, and then say, do we have a rule? If there are rules like there are, to stay close in the picture, dotted cells. If you have a situation about dotted cells around this piece or this area of tissue, then you should classify it as cancerous. So types of cells, types of neighboring cells is the rule-based simple background of these agents. Then different agents with different rule sets. Not everybody knows the same, like in the human-human situation. How to deal with different knowledge. Okay, different tables on the top for rules, and different tables for the beliefs of others. Remember the dialogue, if there is a reason, like, oh, because of these blue cells or dotted cells, then okay. So there is a beliefs table below in each agent that keeps on this motivation or the justification from the other and has a kind of memory about what the other has said up to a certain level during the interactions, during to a certain history framework. Every time this game is like, I think that this cell is cancerous or healthy because of these types of neighbors, because of this rule. And if you keep that, you can develop these agents with these basic questions. I just, instead of formulas, I try to write it all down. What a non-theory of mind agent just expects the same outcome when it gives the same advice. And like I say it's because of this rule, and then I expect the doctor to say yes or no on the agreement. The other agent says, okay, what information did this doctor use for his explanation? What is it that the doctor says? So it's a kind of active learning, online learning then that takes place. And if you update the table using reinforcement learning, you get a kind of notion, a separate model apart and next to your task model, a model about how the other would agree upon your findings. So that takes a while, and this gives these answers, and doctors give answers, agree and not agree, and also vice versa. The agents give and agree to that doctor, and it's over and where you have to go. It's good to see, and then I round up with the experiments that we did. We did this over and over again, 10,000 times. We looked at the baseline agents, what the outcome would be, and we have the ground knowledge, of course, for these experiments. What are the cancerous cells and the healthy cells? We did a little bit analysis, and we came with, okay, how do you judge this at all? We looked at the accuracy, like are there many more cells that were not known by the other how to classify, but during the dialogue now it becomes clear that they can classify it, like, oh, I see this common ground is increased, now I have a rule for this too. The efficiency, how many times did they ping pong and say, when do I agree? There is a stopping condition, but when do you stop negotiation? I think that AI algorithms with theory of mind indeed are much less interaction. And the influence, like if the doctor says I did not agree, but in the end it was like, hey, the AI algorithm was right, or vice versa, the AI algorithm first gave a different answer, but learned during that negotiation to adapt its answer. That's important. So we did all these experiments, and also like, hey, who sets? Who is the expert? Who has the veto and say, okay, but in any case, we have to make a decision after 5 steps or 6 or 7 steps. Now we should just decide because the patient is still waiting there, and either we should stop or continue with the next layer and whatever. The patient needs to go home at the end, or at least sealed. From the research perspective, now you see all these graphs, and of course you see these purple graphs. These are with the common ground knowledge agent. These are higher than the rest. These are results where we did experiments on these validation, these 3 validation rules, and each is left and right, where the AI was the expert and the doctor was the expert, and knowing more, having more rules. And every time so far in these experiments, we see an increase of efficiency. So at the University Medical Center, with the Bernouilli Institute on cognitive learning, we are now in an active experiment with pathologists. And we are trying to get a grasp on this type of algorithm, whether or not baken in or added on top. We are looking at theory of minds, computational theory of minds. That is what I want to say to you. And also, we are continuing these experiments. And it's not that I'm now going to discuss yet another at the end of this talk, but the next case in the environment with dear colleagues from nuclear medicine and medical imaging, NMMI, we are doing the next type of experiments, as where you have, similar to pathologists, this interpretation of scans. And perhaps it's not only about one-to-one, but also in a team where you have multiple doctors and an AI entity helping to classify, but also helping to collaborate. That is it. That's my talk.